The title of this symposium is Neuromuscular Junction Transmission Failure in Sarcopenia. Obviously a hotly debated issue given all the talk about whether sarcopenia is muscle mass or loss in muscle mass or loss in muscle strength. I think this is going to be a really interesting session. Our first speaker is Dr. David Arnold. The title of his talk is Neuromuscular Junction Transmission Failure is Associated with Weakness and Impaired Muscle Function in Aged Rodents. Dr. Arnold.
It's a real honor to be able to talk about this topic. I think Matteo Cesari had a recorded intro, but I don't know if we're going to do that or not. So, okay, so we'll let that roll.
Good morning, everyone. I'm very happy, and it is a pleasure for me to introduce this new symposium at the International Conference of Frailty and Sarcopenia Research. As you can see from the program, we are talking here about an international symposium focusing on neuromuscular junction transmission failure in sarcopenia. As we know, the evaluation of there has been an evolution of the sarcopenia definition over the past few years, and priority has been given to the muscle function and the muscle strength. Now, the risk, I believe, in this context is to go towards something that is very heterogeneous. I mean, behind the muscle strength and the muscle function, there might be multiple pathological pathways potentially impacting. I mean, this heterogeneity may impact in the implementation of the diagnosis in the clinical setting and also in the development of specific pharmacological interventions. In this context, we need to be aware, we need to well keep in mind that regulatory agencies want to look at monodimensional diseases, one biological pathway, one disease, one assessment. In this context, this is a very interesting symposium, I believe, because this symposium provides us a journey in a new opportunity in the field. We will hear the authors talk about a new technique, the single fiber electromyography, that is applied to animal and human models to demonstrate a clear, unique pathway at the basis of sarcopenia. And then in the last presentation, it will be introduced and will be presented the preliminary results of a possible intervention for targeting a very specific biological pathway at the basis of sarcopenia. So I do not want to waste more time, and I will leave the floor to the three speakers. Thanks a lot, and I hope you will enjoy this symposium and the rest of the program.
So my name's David Arnold. I'm a professor in the Department of Neurology at Ohio State University, and I am a neuromuscular specialist. So as this first part of three parts, I'm going to give an overview of our recent work looking at preclinical evidence for failure of neuromuscular junction transmission and its association with phenotypes of muscle dysfunction and muscle weakness in aged rodents. Before I start, I do have a few disclosures relevant to grant funding. Most of this work I'm presenting now is mostly related to NIH funding. I do have some consultant work in the past too related to development and implementation, and thankful to say some treatments for gene therapies that are in the clinic for treatment of spinal muscular atrophy. So as a neuromuscular specialist, I focus on the peripheral nervous system mostly in both the clinic and in my lab. So my lab focuses on translational neuromuscular physiology. And For motor control, the nervous system, the final link between the nervous system and muscle is the motor neuron, and we've heard things about the motor unit already. So the motor unit is a single motor neuron, and all the muscle fibers it connects. So for a typical motor neuron in a large muscle, that may be thousands of muscle fibers, and those final connections are this very specialized synapse, the neuromuscular junction. So we're going to be focusing on the neuromuscular junction as a possible kind of failure between the nervous system and muscle. And so if that signal is disrupted or insufficient to trigger action potential generation of the muscle, then that is going to cause weakness. And that's kind of the background overarching hypothesis of this work that actually started several years ago in my lab. So previous to this, there was a lot of work mainly focusing on morphological analysis of neuromuscular junctions in aged rodents. And historically and consistently, this is shown to be disrupted. In aged mice, wild-type mice, this is generally about the age of 20 months. So it is a relatively late change, but it's pretty consistent across studies. It's hard to know exactly what that morphology means clinically because there's very mixed data in the field. So because it's hard to get neuromuscular junction-rich muscle biopsies, this is a hard thing to study in patients. So it's a little bit of an unknown what happens to the NMJ in older adults. We kind of assume there's disruption, but the direct evidence morphologically is limited. Electrophysiologically, there's less data that has directly tested the fidelity of the neuromuscular junction to transmit a signal to muscle. Isolated in-plate recordings give us ideas about synaptic function, but interestingly, if anything, those are enhanced in old rodents. And so that could be a compensatory effect, but those measures don't directly test action potential generation. And so, accordingly, as a neuromuscular physician who sees patients with primary neuromuscular junction disorders every week, I have a kind of a battery of tests that we typically use. And so these can measure neuromuscular junction transmission on the level of a muscle and also on the level of a single muscle fiber and a single synapse. And so I'm going to talk about two of those techniques. One of these is going to kind of be pervasive through the whole talk, all three, mostly the first two. But the first one I want to talk about is repetitive nerve stimulation. That's supramaximal stimulation of a nerve recording the summated response of the muscle electrically. That should remain stable if the neuromuscular junction is reliable, and the dogma is the neuromuscular junction doesn't fail, it's reliable. But if it fails, such as in a patient with neuromuscular junction transmission deficit, could be myasthenia gravis, a autoimmune condition, here we think maybe aging, that response will get lower. And we can also measure single fiber EMG, which I will go through in a little bit, a couple slides from now. First, we looked at repetitive nerve stimulation. This is a little different than what we do in humans because we stimulate at a higher rate because it hurts to do this in patients and the rats are anesthetized, so it doesn't hurt them. And so what we do find is a kind of a rate-dependent loss of NMJ transmission. You can see the decrement. So that response, the purple waveform, should stay stable. And when they go down, we call that decrement. That decrement indicates failed activation, failed excitation of the muscle. And this shows nice correlations to grip strength. And these rats were 26 months versus 6 months. This is just the NIA aging rat colony. So that's repetitive nerve stimulation. That's the last time we'll really talk about that too much today. Single fiber EMG or single fiber electromyography. This is a selective recording of a single synapse, a single muscle fiber. We do this in a couple ways. One, the electrode surface is very tiny. You can see the photomicrograph on top or superimposed on top of cross-sectional muscle fiber size, and you can see it's very small. And then we also use narrow filter settings to kind of filter out low frequency signal from farther away. And so you can do this in two ways. One's voluntary, one's stimulated. We use stimulated for a specific reason because we interrogate low and high threshold motor units. We think aging affects high threshold motor units to a greater extent. Voluntary, you can mostly just look at low threshold motor units, and so we decided stimulated was better. In this video here, you see 10 hertz stimulation, 10 times per second. There's a normal junction and there's an abnormal junction. So that's from an old mouse there. And so you can actually record from more than one synapse with this technique. We don't know if those are from the same motor unit. There are parameters that we use to determine that it's coming from a single fiber. So this is very selective, different than what other people are talking about with the decomposition EMG. I can't go into details with that, but people use the term jiggle. That's entirely different in a lot of ways, and we can talk, if you're interested, afterwards about that technique. So we basically applied this technique in the same group of rats, young and old, 26 for 6 months, and we show evidence of jitter and blocking. So jitter is that variability you saw of the latency, and blocking is complete failure. And so we see evidence of both of these aspects of transmission abnormality in aged rats. And these are average data per individual rats. These were age and sex matched, so we had a mixture of male and female. And then we also see that generally the weaker rats on grip have more deficits of NMJ transmission. So grip strength is very behavioral in how it's done. So we also wanted to look at evoked muscle contractile function. So this is stimulating the nerve, recording peak force. We also record the ability of the neuromuscular junction to maintain force, and we see in the older rats that there's a tetanic fade, so you lose that force. We think that's coming from NMJ transmission deficit, and we don't see this most really in the young animals, quite striking in the old animals, and this correlates very nicely to both repetitive nerve stimulation and single fiber EMG. So we have applied these techniques in mice and rats. I just showed rats for timing's sake, and we've seen these similar correlations. So this is a technique that we reverse translated. So the next obvious question is this just a mouse phenomenon? So then we studied the rats, and then we thought, well, maybe this is just a rat phenomenon. So then we wanted to translate it to the clinic. And so really that's the next step, and I'm going to hand off to my collaborator, brilliant collaborator and great mentor and colleague and friend, Brian Clark, to really talk about the clinical piece. This work was led by two superstar postdocs, Carlos Padilla and Deepti Chu, who are unfortunately not here, and as you can see, my collaborators in funding.